everyone. We're going to continue today with our second panel, exploring open data, but from a research perspective this time. The panel will be moderated by Dr. Bill McIver, NSERC Industrial Research Chair in Mobile First Technology at NBCC, and we'll explore the use of open data and technology in research innovation. Bill is also an adjunct professor in the Faculty of Computer Science at the University of New Brunswick. So the structure, we've had one cancellation, one panel member is unable to be here. So the structure will be around 10 minutes per speaker, including Bill. There'll be about 20 minutes of discussion led by the moderator, and then there should be plenty of time for questions from the floor after that. And so without further ado, I'll hand it over to Bill.
Thanks. Actually, I think I'm a lapsed adjunct professor. I haven't gotten my application for renewal in on time, so I've been too busy. So first, I'd like to propose an agenda for this panel. We've heard about the opportunities for big data. We will hear in the following presentations and panels issues around policy and legal issues and so forth, and other issues. We thought we would have a panel looking specifically at the research questions and priorities and agendas that exist with respect to open data, and in particular for applications in open government. So I will be engaging our panelists here on this question specifically. What are the major open research questions that exist with respect to open data, and in particular those pertaining to applications to open government? We have had some cancellations, unfortunately, for our panel, but we are fortunate to have Stéphane Robichaud, Chief Executive Officer of the New Brunswick Health Council. Stéphane has had 2 decades of experience in organizational management and public policy development. Previously, he was Vice President of Planning and Operations for the Beauséjour Regional Health Authority. Stéphane has been a leader for the New Brunswick Health Council since it was created in 2008. The MBHC has a dual mandate to monitor the efficacy of health systems performance and to engage citizens in the improvement of their health care services. We are also fortunate to have Ursula Goebel, Assistant Vice President, Future Challenges at SSHRC. Ursula has an educational background in leadership from Queen's University, as well as business and economic diplomas from Algonquin College and John Abbott College. As the Associate Vice President of SSHRC, she collaborates with many researchers from both the private and public sectors in order to contribute to the long-term goal of using social sciences as a means of battling societal challenges. So as usual, I have way too many slides. I think I will focus in particular on research issues and questions relating to my current position and as a research chair in mobile technology. The key area here has been come to be called M-Government, which of course is the application of mobility affordances and technologies to improving the quality, the scale, and efficacy of government services. It's careful. We often fetishize technology, but careful to point out that technologies are enablers. They don't necessarily solve problems by themselves. So I careful to talk about mobile technology as an enabler for improving government and so forth, but we have to also bring other things to the table in designing and operating and maintaining these technologies. So there are, of course, many opportunities that have been discussed with regards to the use of mobile technologies in the context of open government. In particular, the current app culture brings about the potential to distribute useful solutions widely and efficiently to many users. There's also, given the approach to developing apps as opposed to previous kinds of software technologies, it is the possibility to develop them more rapidly and at a lower cost than traditional ICT. There are a number of categories in the literature that, in the research world, that are being examined with respect to M-government. Of course, the ones that are often touted are the government-to-citizen relationships and government-to business relationships, but there are also important advantages that accrue to those within government, or that can accrue to those in government, and transitively have important impacts on society. For us in our research program, these are some of the key challenges. Security and privacy are obvious, or maybe not often obvious examples, but mobile devices are wonderful vectors for private information and giving portals into private information, and so we have to be ever vigilant and careful in designing mechanisms and educating users about these issues. And I'm sure we'll hear more about this in other panels. It's also, what's critically important is maintaining an understanding that we have to have we still have to provide universal service, particularly in the context of open government. We're not talking just about flashlight apps or other kinds of personal calculator apps and so forth. But if we're talking in the context of open government, we have a critical responsibility to ensure that we can provide access and, in particular, universal service through these kinds of technologies. Accessibility and universal design, the design approach which enables accessibility, is actually a requirement in many jurisdictions, and it's incumbent on developers and those who are sponsoring the development of these technologies to pursue these standards. In particular, or one area of research that we are focused on in particular at MBCC is the area of mobile software engineering. There are unique and non-obvious challenges that arise through attempts to develop software for mobile platforms. In particular, there is a tighter coupling between users and their mobile devices, which brings about a greater sensitivity between the design elements that one puts into the software and the responses and attitudes of the user. And so if we're not careful about these things, research has shown that these can create perhaps more problems than desktop or web applications. And there are a number of features within mobile platforms, the power requirements and characteristics, the fragmentation in devices. If we develop an app for iOS, in particular for open government, we have to be able to develop for all platforms that citizens may choose to use. And this is quite difficult given what we call device and platform fragmentation. In the cases of non-life critical apps, it maybe not such a big deal other than the investment that one puts into an app. Users can easily dump the app and go somewhere else or find another app on the App Store. But if it's a life-critical app, healthcare app, or some other an app that provides some other kind of life-critical function, then it really is incumbent on designers to take these issues into account. The lower development costs and the openness of these technologies also brings about what some people are calling the app culture, and I think this raises some risks for us. That, in particular, if we look at citizens as developers of solutions for government, then they may not be aware of or even be concerned about relevant policies and laws and standards as pertaining to the development of apps, and that can cause serious problems, in particular for life-critical apps. There's research showing with Howard Gardner, well-known cognitive psychologist, that there is this evolution of the app generation with various attitudes, including the view that apps can provide quick fixes to problems. And if one has a problem, well, we need only to go on the App Store and find the appropriate solution. But we need to be aware that some issues may include careful democratic processes, and I would augment this and add that they require careful scientific and engineering processes to go into the designs of apps. So this notion of failing, for example, as but one example in processes of innovation is really an incomplete view, that failure has to be looked at in the context of a careful engineering process where the point of failure is actually to learn and then to iterate on what we learn to produce a better solution ultimately. There's also, finally, and I'll end here, the reality that we have many unofficial government technologies arising by virtue of the fact that we have open government, but this may raise attitudes and expectations about the nature of these apps, whether they are official, are they reliable, are they up to date, and again, in the context of a life-critical function, this could be a very risky situation. So I will leave it here to my following panelists to continue. Thanks. So next we will have
Yeah, go ahead.
Okay.
Stefan
All right.
Robichaud. Okay, thank you.
My mic working? Yeah, my mic is working. Well, good morning, everyone. So given we have fewer panelists, I just learned I gained 25% more time. So it's from 8 minutes to 10 minutes. Now, as I prepared my notes, I don't have slides, but I did prepare my notes so that I wouldn't go all over the place. What I tried to keep in mind as I prepared my observations was really from the angle of public policy support. I mean, it's GovMaker conference, so really it's through the experience of the New Brunswick Health Council, and by sharing with you the journey that we've gone through, what are some of our key observations? And I'm hoping that some of those observations will help or will stick with at least some of you and for your thinking and maybe conversations over the next 2 days. The New Brunswick Health Council works in the health sector. The health sector is half of our provincial public service. It's about 20,000 of our 40,000 public service, and it has 40% of our budget, okay? So it's a big part of our public service. And the theme for today, linked to research, is what I think we hear more often than otherwise. And we, as a health council, we're not in the research field, but we've built a lot of relationships with many researchers. And I'd say the most common theme that comes to mind, and my points will deal a bit with that, is researchers want to make sure that what they work on has an impact. So as a researcher, it speaks to the ability of this, let's call it, health sector, I refrain from calling it a system because it's not a system. But this public health sector, its ability to clearly articulate where the priorities are, what those priority angles are, and how research could best help improve the situation, its ability to do that really is a big influencer for researchers in knowing on where to put their research efforts. So I'll share with you the New Brunswick Health Council's mandate. We'll look at a little bit as how our work has evolved. And before the end of that 10 minutes, and I'm glad to see someone has got a little poster in front of us. So if I'm not paying attention to you, throw me a pencil or something. But in that time, I'll relay with you how our experience has enabled us to build an appreciation of, we're here about big data. Sometimes I feel we have to learn to work with small data as well. and how this has given us an appreciation of our work as a provincial government, as a provincial civil service, our ability to leverage indicators to have clearer priorities and perhaps more informed decisions. So the New Brunswick Health Council's got a dual mandate, as was mentioned, to report publicly on the performance of the health system and to engage citizens in the improvement of health services. I'll touch on the points that we're required to report on, but in engaging citizens in the improvement of health services, there's been two key tools we've been using. We have a 3-year cycle of surveys where we survey on acute care, hospital services, primary health, which we just finished. It's 13,600 New Brunswickers that have responded to this, and I'll speak to how that information is helping us in our reporting. And finally, we've had a number of provincial engagement initiatives where we've saw the direct impact of when you put effort at preparing information, bring it in front of citizens, it does have an impact on how they perceive issues. This is healthcare. Everybody has an opinion. And when we bring 100 people in a room to talk about healthcare, there's about 100 different agendas. But our ability to lay the background of what the situation is right now, and if we can do that the right way, it does galvanize their attention to where priorities should be going, or where our attention should be going. As we started our work, and as an organization, we're given all the legal powers to access whatever information is required to do the work we need to do. So whether from the minister or any provincial body that has information that can enable us to do proper public reporting, they're required to give it to us. The situation we faced in 2008, 2009 when we started, I fear, is very similar to many of your situation in 2014, which is there was no provincially standardized, recognized, trusted indicators when it came to population health, health service quality, or on the sustainability of our healthcare system. There was tons of data. We were what's called data rich, but really information poor. This doesn't mean that in half of our public service, and when you look at the importance this sector has in our government, it doesn't mean that there weren't any evidence-based decisions being made. But there was no proper grasp of the overall picture. There was no, and in the 1 year that I managed in one of the health authorities, what I found very interesting is whenever a report would come out that would suggest our health authority was doing a great job, there was never an issue with that report. It was when, as a manager, if I wanted to leverage where we weren't doing so much of a good job, how quickly we could demolish the indicators in the report and say, well, they don't collect that the same way as we do. They don't measure it the same way as we do, and there are problems with that. And I'll talk about that in a second or two. And what we had as indicators tend to focus mostly on what was easy to measure. Volumes, inputs and outputs, a lot of that. But we're very weak, and this is still a work in progress, on measuring results, on measuring outcomes. If we're investing all of these resources in our healthcare sector, public healthcare sector, are we getting the results? And the short version of that story is that when you look at New Brunswick compared to the rest of the country, we don't compare very well when it comes to the health of our population. We have many weak links when it comes to health service quality and providing it in a standardized way across the province. But from a resource perspective, we compare extremely well to the rest of the country. We're either at national average or way above national average on how we spend per capita and on the number of many professionals in our sector. So there's something to be done there about better understanding the results we're meant to deliver and better utilizing the resources we have to get those results. In our approach, what has helped us in our approach is really to ensure that early on we had a structure, that there was a purpose to going into this world of all of this data and all of these indicators. So in our case, when it came to population health, as an example, a very key theme that came out very early on is health determinants. So people were saying, if you're going to report on health, and if you think about it for a second, let's say you're given the job to report on how healthy are we as New Brunswickers. How do you measure that? Is it the absence of disease? Is it how much disease there is in a population? How do you measure how healthy a population is? There was people were quick to rally around the concept of health determinants, and on those health determinants, then the work on our end was in identifying those indicators that would be recognized across the field in determining that. And very quickly, it's things on health behaviors was seen as about 40% weight on health. Then socioeconomic factors, 40%, 10% health services, and 10% the environment. So that's how that model and our work towards indicators went in that direction. On health service quality, we had dimensions: accessibility, appropriateness, effectiveness, efficiency, equity, and safety, which really targeted our efforts at what type of indicators we needed. And on sustainability, we looked at comparing New Brunswick to the rest of the country. And that's basically how we started building. If I knew I had 10 minutes instead of 8 earlier on, I would have shared with you a quick video, a 3-minute video on our community profiles. And community profiles is that New Brunswick has been divided in 33 communities with close to 300 indicators for each one of those communities. We gone 8 years ago or 6 years ago where we didn't have much ability to compare New Brunswick to the rest of the country. Now we've got these tools at the community level, which is informing people on how their community compares to the provincial average on many key areas pertaining to health, and it is having an impact on the types of discussions we're seeing locally. And I'll close on this. So essentially, Twitter, there was an interesting article on Twitter in the Globe and Mail. I don't know if you all saw that. So really it was about how Twitter is repositioning itself and how it's focusing on and how it'll be leveraging big data actually. But it's not using big data to figure out where it's going to prioritize. It has a very clear idea of where it's going. So mining big data with a clear sense of what you're trying to do with it can amount to a waste of time if you don't know why you're going down that venture. In the case of our government, really it comes back to our leadership capacity. So really from a leadership capacity to clearly articulate where our priorities are, and that when we have this direction on wanting to mine our data, that we know why we're going that area. And also on the data itself, it will be no surprise to you that it's not all apples able to compare to apples. And for us, maybe the last thing I'll leave this with is, we've learned in health that there are issues as to if you're reporting collectively currently, not everybody measures things the same way. And someone could say, well, it doesn't really matter. Well, I'll give you an example on MRIs. When we started reporting on how we compared in many localities, how some people would measure one MRI, you go in and you have every time I say that, I pick the wrong part of the body, but your elbow and your wrist, some people will count that as 1, where in other hospitals, they'll count it as 2. Well, if you're trying to get some collective picture of where we stand, it's really important that we have proper standardized way of collecting this so that when you do look at this in a global way, you get a more precise picture. All right, thank you.
I'll just go right up. No seconds to spare. Bonjour et un grand merci à Nick et le réseau de recherche politique pour m'inviter aujourd'hui. Je suis très heureuse d'être ici. I'm particularly glad that Gail MacDonald can see that I'm here because Gail promoted this conference just 2 weeks ago in Ottawa to a very illustrious group, and she'll be back in Ottawa in 2 weeks. So I am here, Gail, and you can see that. I have to just also comment on the great video that Nick showed in terms of the skateboarder. And I was trying to think of the analogy because all I could think of as a parent is the parents who let that 4-year-old start on that skateboard, and now that parent of 12-year-old saying it. So in the analogy of the ecosystem, would that be the banker, the investor with a very low or very high risk aversion threshold? So my presentation is going to focus on, to complement the focus on open data, about the issue of data management. And once I get the clicker here. Mes remarques seront surtout en anglais, mais les diapos sont disponibles en français aussi, et je suis toujours disponible à vous répondre en français aussi. So, who here is familiar with SSHRC? About 2/3 of the room. For those who are not, we are a federal research granting agency that funds research about people, human behavior in the past and the present, to build a strong future. And how do we do that? We have 3 primary sources of doing that. We invest in talent. We invest in students and scholars. In fact, 70% of our budget, we have a budget of approximately $360 million to support research and talent in the country. We also manage a number of tri-council programs, which comes to a total of about $1 billion in research in Canada. We support great research excellence. It's for those who have a research grant from SSHRC, you know how challenging that is, and so it is a very, very competitive, rigorous process. And we invest also in connection and facilitating the connection among researchers and scholars, but also with non-academics, to ensure and to help ensure that that research is in fact, accessible and benefits Canadians and communities. And we also facilitate that through partnerships. But why data management? And this is where the focus of the discussion will be for me in this context of the theme here, because it is fundamental to research excellence. And it's also a foundation for which open data is available in terms of providing that access. But we also, and we've heard this quite well this morning, the issue of appropriate protectiveness in protections and safeguards that are in place, including privacy, including confidentiality and security, or paramount. And so a bit of a background here in what we're doing at SSHRC in collaboration with the other granting agencies and SSRC and CIHR, as well as the Canada Foundation for Innovation. A few years ago, almost a few years ago, in 2013, we launched a consultation in terms of establishing a framework for data management practices in Canada, recognizing that, yes, there are tremendous challenges currently. We have different approaches between faculty, between disciplines, between institutions, between provinces, between countries. And so how do we start creating that framework that would establish some fundamental principles, fundamental harmonized approaches to data management by the researchers and that we support. And so this consultation was underway for over a year, and there was a paper on digital scholarship. It is still available on our website, so you're welcome to look at that. And it really speaks to a culture of stewardship in Canada, a culture of data stewardship in Canada. CIHR, of course, when we talk about this in the context of open access, CIHR does have a policy on open access for research data. And now with SSHRC and NSERC, we are working on harmonizing an open access policy, and hopefully in a couple of weeks we'll be hearing more of that in terms of the release of that policy. But within that tri-council approach, some of the key considerations that we were looking at was, in fact, a requirement for all grant applications to include specific data management plans, including the cost of data collection and analysis, the preservation of results and associated data sets, some definition in terms of the specific elements of those data plans that could be considered by reviewers and assessors, as well as looking at what are the guidelines that we should be establishing that would recognize different data and how those different data should be preserved, could be preserved, and in different formats. We are looking at consolidating these open access policies, as I mentioned, and guidelines, but then also in the context of looking at suitable data repositories, and so data repositories that can speak to each other. And I also want to put this in the context of the international context, and certainly a lot of work that's underway now in looking at how other countries are approaching open access and data repositories. I'll just mention one particular initiative that's underway at SSHRC. In the last few years, we've led what's called the Transatlantic Platform. And this is an opportunity that we, under the stewardship of our previous president, Chad Gaffield, to position Canada in a leadership stage, if you will, to facilitate, in the context of facilitating research collaboration internationally, to work with other granting agencies in North America, South America, and in Europe to start looking at digital scholarship. And so the use of digital online repositories and digital analysis, data analysis in social science humanities research. So as we're working through now a collaborative approach with these other granting agencies around the world, we're also recognizing that as we're moving forward with open access policies in Canada, we're looking forward towards data management policies within our ecosystem here in Canada. How does that connect with the ecosystem in those other nations? Because when we are able to provide these one-stop channels to support and enable international research collaboration, we have to recognize that those researchers in those countries also have their requirements, their harmonized policies to abide by. So in terms of what's happening next in terms of our data management policy, of course, there's been reference to open government and Canada's participation in the Open Government Initiative. Of course, we're one of 65 countries that are part of the Open Government Initiative with the principles of providing access, citizen access to administrative data sets, and also in the context of open science. There's a website there that you can take a look at for more information on that. In terms of next steps for us in terms of data management policy, so there will be now the final stage of consultation on the guidelines forthcoming in the next few weeks. As I mentioned, there's work that's being done in collaboration internationally, looking at what other countries are doing so that we can take that into account when we're looking to facilitate international research collaboration. We've just commissioned a study on current practices in Canada and internationally on open data, data management, and funder requirements for data management plans. I've got 2 minutes and I haven't even hit the next part of my presentation, so I'm just going to move on very quickly. So there you'll see some few steps in terms of next steps for us. And we are in discussions with CORA. A number of these acronyms the non-academics won't know, but the academics certainly will. But I do want to take, and there's some contact information there, and my presentation is available to you, so let me take a few minutes just to talk about Imagine Canada's future, because we're talking about data management plans and open access, but I want to get back a little bit to the topics that were discussed in the first panel in terms of, well, how will this help? What are the issues? How will greater access to data benefit Canadians? And just to put a bit of a framework on that, SSHRC led a foresight exercise to help identify what are the greatest big challenges for Canada in the next 20 years, and how can our community contribute. And certainly Gail was part of that consultation process. And through this very rigorous process, 6 future challenges came through. And that's just very quickly in terms of what we're trying to do. So 6 future challenges came through that consultation. Now, these are Canadians, these are sector leaders, these are researchers, and in that you'll see a variety of issues, but are also very interconnected. So the issue of how emerging technologies can be leveraged to benefit Canadians, I'll just focus on a little bit because it was certainly relevant to the earlier discussion. So now we are undertaking a number of initiatives to realize greater focus on this, certainly through our programs that we fund research through, but also in terms of activities such as this event here. How can we facilitate greater interconnection between the academic sector and the non-academic sector with a focus on these issues to realize the knowledge that we all have, the expertise, expertise and the insights, but now facilitated with open data? How can we certainly realize this, but in parallel with the exponential pace that data now will facilitate knowledge and insights too? And perhaps in the discussion I can talk to you about a few initiatives that are underway with specific activities here, such as virtual communities of interest. I have 1 minute left. Okay. So as I mentioned, a number of activities related to knowledge mobilization and engagement, building research capacity around these particular issues. The issue of rural was discussed earlier, so again, how those key themes address the issues and the challenges and the opportunities for rural communities. This is a very, very focused effort for us at SSHRC, and so I think there's a real opportunity for New Brunswick to participate, and particularly graduate students and students, post-secondary students. I think I'll just end there because I've got 2 seconds. Thank you very much. Merci.
Okay, so now we have, how do we have for questions, Lorna? Okay, we have 14 minutes for questions. I encourage people to come to the mic here. I'll start off with a few questions. Stefan, you mentioned in your presentation the notion of or differentiating between small data versus big data, and in the the big hoopla over big data, that small data is something that we really need to pay attention to. Could you say more about that? Specifically, what kinds of data do you mean, and what issues do you have at getting at those data?
Perhaps small data versus big data is not the analogy that best reflects the point I was trying to make, but it's in essence, it's directed towards, from a leadership perspective in public policy, the current culture and the lack thereof of using our indicators, our data, from a public policy support. What we have right now is a very selective use of data or indicators. So if we're proposing a solution or if we're promoting a decision, we will use the indicators that support that. But on the flip side, understanding the clients that we're meant to serve, New Brunswickers, there's been very little progress, or it's that capacity of understanding our population is very much eroded. Anne Hébert shared earlier some numbers, some demographic numbers. At the council, what we've been highlighting is how much the north of the province has been aging much faster than the south of the province. And I made the point to all of our deputy ministers of saying, our decisions on health services over the last decade have not taken that into consideration. What Deputy Minister quickly told me was, it's not been part of any of our departments' consideration. So that's the small data, is just saying there's a lot that's within our reach right now that we don't appropriately utilize to establish the types of priorities, the areas where we need to go, where that mining the big data part could enhance our ability to go down those roads.
Okay, and are there, just a follow-up, in terms of what we in computer science have come to call data engineering and the data science, are there particular research problems that you've identified that would help you do that? You've talked at a policy level and leadership level, but in terms of the mechanisms that would help improve that for you, have you identified those?
Part of the capacity building that we need is that many of those in positions of having to manipulate that information to support with the decision, I'd say there's two parts of that capacity. One is, and I'll really be simple here, I mean, it's the simple use of Excel or the proper use of Excel spreadsheets, as simple as that. We don't have a minimum amount of capacity within our management to just understand the basics from that. Secondly, because from a leadership perspective, we don't, at the end of the day, really strongly use what we're learning. What we collect has evolved by default over decades, whereas there's so many different ways today. You'll have, I have some health services where I've seen people take data about the patients they're treating, and it's somewhere in an Excel file. Somewhere else, it's right into the Meditech system. Somewhere else, it's part of a... So if you're coming at this from a big data, for that particular population, you've got such a diverse way of manipulating that data that it could be, what you look at the global picture, you're missing various points of that reality.
Okay, thank you. Ursula, you spoke about the efforts at the federal level and within SSHRC in particular around open access. And again, pushing down to the technical level, there's been a lot, as you know, in the computer science world and data engineering and data science, and in particular around the notion that Tim Berners-Lee has really been pushing around linked data, and in particular linked open data. Are there efforts within SSHRC and perhaps in cooperation with NSERC around building and providing those mechanisms to researchers to format their data and publish it in these formats?
Yes, I mean, there's a number of initiatives underway. I mean, actually on two levels. Certainly at SSHRC, a few years ago, we launched the Digging into Data program. And what that program aimed to do was and this is years ago, so it seems like, well, of course now it would happen, but back then, and this was only 5 years ago, to really start focusing efforts to support digital scholarship. So essentially enabling researchers to really actually start doing stronger data analysis using data sets, and doing it again, starting in a collaborative international forum. And so we partnered with research agencies in the UK, in Australia, in the States, and it grew, and now NSERC and CFI have come on board, Canada Foundation for Innovation have come on board. So, and what's really interesting there is that these research teams are interdisciplinary, is very much an interdisciplinarity approach. And I think this is fundamental to our research environment, and we'll see this with graduate students particularly, is working together. It speaks to the lack of skills. It speaks to enabling research to really get to that next level of computer scientists working with musicologists, working with sociologists to really start analyzing the data and bringing the approaches of how research is done in new ways. And so digging into data, as an example, was one initiative that we undertaken. In terms of to the second point of your question, so the open access policy, which will be coming out in a few weeks' time, does address the issue of requirements for open access publications with a focus on journals as a start, and it speaks to some guidelines there in terms of repositories. So that the aim there is to start moving towards a harmonized approach for open access among all of the granting agencies. As I mentioned earlier, CIHR has one, it's very clear. SSHRC had a we encourage you to approach, and then CERC didn't have one. And so a lot of work has been going on the last few years to at least start harmonizing it so that it's consistently approached.
Okay, and also I was wondering if you could say more about the 6 issues that came about as a result of your foresight exercise. What were the challenges?
So, and I've got some sheets out as well. So 6 future challenges emerged from this foresight exercise. There were 4 themes that were there. I don't know if I actually want to click back to the slides so that you can actually see the 6 if there's somebody at the technical room. And so there's 6 challenge areas addressing issues of what new ways of learning do Canada have to address from K to 12 and post-secondary to address our evolving society and labor markets. And so that also speaks to the issue that was discussed earlier in terms of the skill set and being able to, for data analysis, issues of globalization, issues of emerging digital technologies, issues related to the aspirations and experiences of Aboriginal peoples. No, backwards, the other way. For the emerging technologies and the ways of learning, I'll just speak to 2 initiatives that you may be interested to hear. So for new ways of learning, we have an advisory group comprised of private sector, IBM, Desire to Learn, the Conference Board of Canada, Economic Social Development Canada, the Council for Ministers of Education, a real varied group with regards to the issue of new ways of learning. So in January, we're launching what's called a Knowledge Synthesis Grant. It's an opportunity for scholars to be funded to be able to tell us what is the current state of knowledge on this issue of new ways of learning. What do we currently know? What are the gaps? What are the opportunities? And this is so relevant to the discussion that transpired in the first panel, because we have to look at what research currently exists that we can take advantage of. Issues of using avatars in 3D environments to facilitate learning in a learning environment. There's so much research that's currently available that can really address some of these issues that we were discussing, but at the same time there are gaps. So we're launching this, and the reports will be coming out later in the year, and we'd be happy to share them with all of you. The issue of emerging technologies, a number of initiatives on that front. We're looking to develop a few what's called virtual communities of interest. So we, of course, at SSHRC have a website. It's a Government of Canada website. But these discussions, such as this event today, we want to ensure that the discussion continues. So we're working with a number of partners to create a portal, a virtual platform portal, that will connect the opportunity for researchers to connect with small, medium-sized enterprises in the area of digital adoption. So research dealing with a digital adoption to facilitate those companies to grow, but at the same time, companies who are in ICT to have access to research in terms of enabling their business to grow. So a number of great collaborations are emerging with this focus now on these particular issues.
Okay, are there any questions? Yes.
So what I want to ask both of you, so hi, my name is Lisa Rodlick, is when you think of all the data and projects that you see before you, could you give us a couple of examples of something we could get going on right away? So in your case, Stefan, like of all that data that the Health Council collects, and I do love your community profiles. Those are so much fun to read. I highly recommend anybody go check them out on their website. They are so much fun. So when you look at all your data, what could we just like, you know what, it's there, let's go. And in your case, Ursula, in terms of maybe much more of a systems approach, you know what, we can go.
I guess I owe you $20, Lisa, for the publicity. Okay, simple question. The answer is not as simple, but I would say two parts, yes, two parts to it. Those in data mining would say that much of the data that we have at the council, for example, because a lot of it is self-reported, they wouldn't have a high level of comfort. But from the administrative data that we gather, from a health service perspective, I'll use one clear example, chronic pulmonary diseases. It affects a very small proportion of our population. In fact, it doesn't make the top 10 in most of our health zones. Meanwhile, it's the #1 user of beds. Okay, it's the #1 of hospital beds, and these are conditions that if we could better understand this population, better understand how it's currently leveraging our services, how it's interacting with our services in order to maximize our interaction with it, we could do much better. And these are hospitalizations that could be prevented if we did a better job. So that's the one example that comes to mind is we have now parts of our population for conditions like, for example, COPD, where we could do some work at better understanding the current journey of those people and how that journey needs to change to do a better job in preventing hospitalizations.
Yeah.
Well, two things, and I think one, you're doing it. I mean, you've got this conference and you've got Michael Geist here, and I think this speaks to the issue of incorporating research in the social science humanities that really addresses socioeconomic issues related to big data, related to open data, with regards to even emerging digital technologies. And there was a time that it was an afterthought, right? We're going to build it, we're going to build the system, we're going to build the infrastructure, we're going to build the grid, and then we're going to start thinking maybe a decade later about, oh, well, maybe we should start thinking about privacy, the internet. Oh, maybe we should start thinking about confidentiality. We have the opportunity as we move forward in the country to really position that leadership that we've got. Great expertise that helps us to address is that we can move forward with respect to those socioeconomic issues. And the second is talent. We have an opportunity as post-secondary institutions, not as pre-post-secondary institutions, as communities, as educators, as leaders, to really focus on ensuring that our students, our skill set have the expertise, have the knowledge, and to enable now the benefits of big data to grow. And so I would focus on those two issues particularly.
Hi, Bill. I'm actually going to pick up on one term on one slide that you did there, and that was the word official app on there. So with the City of Fredericton, we've bought into the open data, and we want to provide our information, but it's freely available for people to come and grab. We don't know who's using it necessarily and how it's being used. So I'm not sure what the definition you're saying on is as an official app, because that is a concern. Like, are these people that are taking our data, doing research, or building these apps regularly refreshing their data sets from us? Because the perception often is that it is something supported or is agreed to by say the City of Fredericton or other levels of government. So there's the risk there if an app is, say, out of date, unsupported, and so on. I'm just curious as to what you mean by an official app. What makes it an official app? What kind of processes do we have to go through to get that?
Yeah, so I did, you know, because I had limited real estate, I chose one term, and it was, you know, pretty coarse-grained term. But in that context, or in this context, the official app would mean something that you, the City of Fredericton, would sanction, that you would maintain, that you would improve if, you know, if there are data quality issues or user interface.
So it's a City of Fredericton built app or funded app?
Well, either built or you sponsor through contract the building of that app. But we see many apps. The TTC, for example, there are many citizen-generated apps, many of which are useful. I'm not necessarily criticizing them, where people are able to use open data to create useful functions. But there are issues where you know, certain attitudes or expectations or even maybe misunderstanding about the nature of those apps could create some serious issues. So, and in perhaps maybe an indirect example, it's not dealing specifically with open data. During Hurricane Arthur, for example, we saw here a number of cases where people were using Twitter to send notices to the fire agencies or to NB Power. You know, I saw some of them. You know, my transformer's on fire in the backyard. You know, people just simply not understanding you know, the proper channel through which they should support, and that's you know, an example that comes to mind. But you can, you know, you can you know, sort of understand that in the context of an app that, you know, some citizen might generate, that they might create. Does that answer your question?
Yeah, but certainly from the other levels of government, like if you're a funding agency of these, there must be some concern because there is some kind of a tie back to you then if a program or an initiative goes awry and it doesn't work properly or is unsupported, like how does that affect?
Yeah, I think, you know, there's, it's interesting because we've seen hackathons taking place at all federally funded hackathons and so forth. And the issue comes to, from my perspective, you know, to the credibility of the data. And so that then speaks to a lot of the issues that we were talking about in the context of this framework in terms of what is open data and all the issues of authenticity. But as well, it also speaks to, well, what are the opportunities, though? We spoke about social entrepreneurship this morning as well. Maybe there are opportunities that truly would benefit a community in terms of the appropriate apps that uses data to really benefit a rural community. And so I think we have to look carefully rather than completely swaying to saying, you know, it's too complex and we should turn away from it altogether to say, okay, if we had the framework, if we had the system with credible data that has already fit into the framework of privacy is respected, confidentiality is respected, the data sets, it hasn't exploited the researchers' data, then perhaps there is data that can in fact still be used in the appropriate fashion and that can truly benefit. So I do think there's still an opportunity with apps.
Okay, our last question here. No,
Okay,
go ahead. We've got 2 minutes.
So my name is Ryan, and I'm one of those citizens that actually works with open data. And so I have a quick question. I've seen your community health reports, but as one of the people who is looking to access that data and work with it, to me they're trapped in PDFs. I can't really get it in an easy way. It's hard to work with. Is there a strategy or a plan in place to take that data and to make it easier for people like me to take it, visualize it, write stories about it, that kind of thing?
The intention is there. So in the case of, I know in the case of our, we've been at what we've been doing now for 5 years. So our initial challenge was identifying where those indicators were, how to organize it, and by default this PDF base. So the community profile Lisa speaks to brings you an image and the data is there. Unfortunately, because our infrastructure doesn't allow it, whenever someone contacts us, we facilitate their access to the Excel files and those things. Our aim is now that we have the base to find a business enterprise or a way of managing that data internally that makes that access far more simple. Because by law, we're required to make public everything we do. So the data part for us, obviously, we'll want to protect confidentiality and so on, but that's very much part of the journey that we're on.
Okay, well, thank you to our panelists. I know our slides and other materials are available, so come see us afterwards. Thank you very much.